Well, a new report by the Royal Flying Doctor Service has found that mental health disorders affect people living in the country at the same rates as people in the city.
But distance and isolation create huge barriers when it comes to treating mental illness in the bush. The Royal Flying Doctor Service runs mental health clinics but says more funding is needed to provide adequate services to people living in the country. Frank Quinlan is CEO of Mental Health Australia and he joins us now from Canberra. Frank, good morning to you. Thanks for your time today.
Good morning.
Just how big a problem is dealing with those suffering from mental illness in rural and remote areas of Australia?
Mental health issues affect nearly 1 million people living in rural and remote areas. And on the basis of this report today from the Royal Flying Doctor Service, we know that they access services at about 1/5 the rate of the rest of the community. And what that means is that people are going to get sicker and they're going to need more intensive supports when they eventually get it. And as the report indicates, I think that means that we need to be doing a much better job of delivering services to people where they're needed.
Before we look at potential fixes to the problem, how are people currently treated by the RFDS who have mental illness?
Look, they have a range of programs and that's one of the issues that we could discuss. They draw funding from a very wide range of sources and as you said in your introduction, they deliver services into communities. They often fly in with expert clinical care and they also do emergency evacuations of people out of communities when they need intensive support. It's a tremendous service and I think we should be commending the Flying Doctors for their ongoing service to remote communities. But it's also clear that we need much more service, and we need much more service in particular that's local to communities, that is culturally sensitive in the case of Indigenous communities, and that supports people in the communities in which they live.
And the impact of not addressing this can be quite devastating, where you can see that distance and isolation when it comes to treating mental disorders can be seen in the suicide rates.
That's right, and it's not just the suicide rates. It's across a range of areas. People die sooner because of these issues. So we know that people will die earlier, not just of issues directly related to their mental health issues and die sooner by suicide. But we know too that people will die sooner of cardiovascular disease and diabetes-related illness and other related illness because there simply isn't the adequate and integrated care that people need.
So what sort of funding do you need and where would it go? Would it go to the RFDS in delivering its mental health outreach services, delivering mental health nurses and doctors to areas? How much do you need and where would you deploy the funds?
Look, I think it's a range of responses and we certainly need funding, but I think we also need better coordination between existing services so that people aren't being bounced around from one service to the other. But I think the principal sort of investment that we require is in local community and community-controlled programs, whether they be Aboriginal communities or other remote communities. I was lucky enough to visit services on Elcho Island, which is in far north of Australia in East Arnhem Land, services run by MeWatch. And the Aboriginal community there has really taken control of the local programs and delivers a suite of programs to their community. But they really struggle to attract the sort of funding that is required to maintain even those simple services. So I think we need to look to the strengths that exist in local communities and deliver the sort of funding supports, often modest funding supports, that are required to keep those services going.
How do you deal with the social stigma that might still surround someone who wants treatment for mental health issues but is reluctant to do so?
Again, I think we need a multi-pronged approach to that. The particular problem in rural and remote communities is often that they're small and that people will know the service providers and people will know who's doing what in the community, and that can be pretty challenging. I think any of the work that we can be doing to be breaking down stigma goes a long way to making the act of reaching out for mental health services just as appropriate as the act of reaching out for other health services. I think that's where we need to be aiming for. But we also need, I think, to be looking at innovative ways of bringing in services from the city into these remote communities through technology. We've seen the government quite recently allow remote telemedicine services to be delivered in the mental health space under the Medicare benefits scheme. And I think we need to be looking at some of the creative models like that that can bridge the gaps. I know that's not a response in all of these communities. A lot of these communities are really off the grid. But it's important, I think, that we have telehealth services and new digital services providing services where they can.
Is it fair to say that the Royal Flying Doctor Service is picking up most of the slack, though, in helping people in remote and isolated areas with mental health issues? Because if you look at some of the stats from this report, over 3 years from July 2013, the RFDS conducted over 2,500 aeromedical retrievals.
That's right, and I've been lucky enough to speak to some of the staff who provide that service, and it really is something of a Sophie's choice, if you like, because taking people out of their community when they're terribly ill is not always the best solution. But neither is leaving people in their community if perhaps the only alternative service might be to have people in a watch house, in a police watch house. So I think we need to look at ways of building up the local resource in those communities so that people are able to receive care closer to where they live and so that their lives are less disrupted, because these are very disruptive interventions when they're required.
We've spoken about multi-pronged approaches to assessing the issues that are facing those in isolated and rural areas who are suffering from mental illness. But what would be the first step in addressing these issues, in your expert opinion?
Look, I think in the first instance, we need to magnify the services that are being provided. So we know that there are services working today on the ground that are effective, and we know that they don't receive adequate funding and that they don't receive security of funding, so they have a lot of trouble surviving. So I think as a first sort of triage measure, we would settle those funding uncertainties for programs that exist. Secondly, I think we would take the initiatives that are currently integrating services across programs, and we would do a better job of linking those up. And then thirdly, I think we'd look at new and creative ways of delivering services into remote communities. We'd look at training up peer workers and people on the ground who can be delivering support in local communities, and we'd do a better job of bringing in the expert help that is required from outside those communities so that those local workers can be better supported.
Frank Quinlan, CEO of Mental Health Australia, many thanks for your time.
Thanks very much.